Hi everyone, welcome to our Facebook Live Tuesday series. Today we are celebrating National Physical Therapy Month. It is October and I'm so excited to share information with you about physical therapy. I am Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness, and I am a physical therapist, an athletic trainer, and a fitness coach. And today we are going to talk about what do physical therapists really do? Well, I'm here to share with you that we are not just people who get people back from sports, and we are not just people who get people back into recovery from surgery. We do those things, but we are so much more. And I am super excited to share that with you because I get that question a lot. Like, what exactly do you do for a living? And basically, I usually say, you know what? I help people solve their problems with their body. I'm a musculoskeletal specialist. I'm a movement specialist. I help people move better and feel better so that they can do what they love. So I do a variety of things. And as a physical therapist, I have the privilege to help people feel better and get rid of pain. But getting rid of pain isn't just the one thing that I do. When a person walks into my office and has pain, I can absolutely start there. I want to get their pain down, and I want to get it down hopefully within that session. My job is I'm in the pain relieving business. That's what I like to say. I'm in the pain relieving business, not the pain causing business. So when people have these horror stories that I hear, or these myths about physical therapists being physical torturists, that is not true and should not be true. Physical therapists should be helping people reduce their pain. We might actually change their pain a little bit though. For example, there is good pain and there is bad pain. Bad pain is what usually people are drawn into my office for. For example, if they have numbness or sharp shooting pain or tingling symptoms, pain that's radiating, or pain that's just not going away. That is what I typically see. However, when I give them certain treatment plans, their pain might change. They might now have good pain, which is muscle soreness or tightness and symptoms like that are kind of dull and achy. So it's my job to really teach people that you came in with these bad pain symptoms, but now you're leaving with symptoms that kind of feel like you worked out. And that's a good thing. Why is that a good thing, to make somebody feel like they have dull and achy soreness? Well, that's not what I want really either. But in the beginning, when people have really tight muscles, I might make them sore because now I'm making them more flexible. And I'm increasing their range of motion and I'm improving their mobility. Your muscles and your soft tissue surrounding a joint may not have been in those positions for a while. So that's why people get sore. If somebody comes into me with a frozen shoulder and they haven't been able to move their arm above shoulder level or 90 degrees for 3 weeks, when I start to be able to implement techniques and exercises that move their arm above 90 degrees, that might be a little bit sore because it might feel kind of stiff to do that. That's a good type of soreness because we're making that joint move the way it should. Now, if it's sharp and shooting, that is not what we want as a response. So then we change what we're doing. So pain is one of the things that a physical therapist can target and help to decrease. Range of motion, flexibility, joint mobility, and general mobility, helping people just move better, getting in and out of bed, getting in and out of a car. These are also things that a physical therapist can do. What about strength? Physical therapists can help people improve their strength. For example, we all have different strength needs. Somebody who's come out of surgery or somebody who was in the hospital for a major procedure or had a traumatic event, their strength goals might be just to be able to get in and out of bed, just to be able to walk from their bedroom to their kitchen, or complete short errands in the community, versus an athlete who wants to get stronger because they want to jump higher, they want to run faster, they want to have power, they want to be stronger if they're blocking, like if they're a lineman in football. These are different strength goals. They don't need us to work on walking. They need us to work on power, agility, and strength for their sport. Physical therapists can absolutely help with that as well. And that's a whole other area besides what most people think of as what physical therapists do. We help with sport performance. We help people reach their goals in fitness. And we help people compete, whether you're a weekend warrior or whether you're an avid exerciser or whether you're an amateur, a semi-pro, or a professional athlete. Physical therapists can create tailor-made programs to help reach any of those goals. Another area that physical therapists can help with is balance. A lot of people think, oh, we need balance because we need to be able to walk down the steps and not look at our feet. An example of this would be carrying groceries into the house and carrying grocery bags maybe down into a basement freezer or refrigerator. You need to be able to carry that stuff without looking at your feet and without holding on, because you're holding on to the bags of groceries. So that's one aspect of balance. There's also balance in kids. Some kids have delays in the way they develop, and creating balance activities that challenge them but are also fun and like play are great ways that physical therapists implement balance skills for children. Balance is also incorporated in people who have had surgery, people who have balance problems, or who have inner ear dysfunction. So when I talk about that, if you've ever stood up too quickly and you're like, whoa, the room is kind of spinning, or wow, I feel a little bit dizzy, that is related to your inner ear and your balance. Some people get that a lot, and physical therapists can help work with the inner ear so that their balance can be restored. Simple things like standing up from a seated position, or getting in and out of bed, or just walking across the room, or for kids, walking down a crowded hallway at school while you're walking one way and kids are walking the other way. That is a big complaint that I've had with patients who have had headaches, migraines, or a post-concussion. Their balance is thrown off. So physical therapists can help with that through different type of techniques, different exercises, and different positioning to help so that they can move their head and focus their eyes while people are moving in the opposite direction. Another skill associated with balance is actually driving. If you're driving on a busy road and the cars are going past you, you cannot be dizzy with that. You cannot be dizzy walking downstairs when people are walking past you, or riding on an elevator, or on a moving sidewalk, such as the airport tunnels. These are all things that people need to do on a daily basis, especially if they're a business traveler, or just picking up friends from the airport, or just staying at a hotel, or going to a conference. These are all things that people need to do, and if their balance is thrown off and their inner ear is not working properly, then the physical therapist can help create a rehab program that they can have during physical therapy as well as after they're done with physical therapy, so the problem doesn't come back. So I've listed a lot of things. Physical therapists can help post-injury, they can help post-surgery, after trauma, after sport injuries. They can also help prevent injuries from even occurring. And this could be decreasing somebody's risk of falling so that they don't ever fall, and that could be improving their balance. It can help with, physical therapists can help with teaching people how to get in and out of bed, how to do chores around the house, like their laundry, raking leaves, mowing the lawn, all of these activities so they don't have back pain or neck pain. We help people get rid of pain. We help people get back to moving. We help people restore their strength. we help people restore their balance, and we help people prevent injuries from happening. Physical therapists like myself have many specialties too. Some of us focus on back and neck pain, some of us focus on sports injuries, some of us focus on women's health and incontinence issues. Regardless of what it may be, if you have a problem with your body that it's not moving or working the way it used to or should, physical therapists can often be a first call to help you figure that out. Physical therapists are problem solvers for the body. We know about how to make it move better. We know how to make it stronger. We even know a little bit about nutrition, although we don't set up individual plans. We keep that in the scope of a dietitian. But we know general nutrition principles and can help people with exercise to help if they're on a weight management plan. These are all things that I do at my office as a physical therapist, as an athletic trainer, and as a certified personal trainer. So I collaborate and coordinate all of those type of specializations that I have within my office so that I can offer a comprehensive and whole body approach to my patients. And many physical therapists across the country do that as well. So there you have it. Physical therapists are movement specialists who solve problems related to muscles, joints, bones, the spine, and the balance of the body. In short, we help you move better. We help you feel stronger, and we help you last longer doing what you want to do. If you have any questions about physical therapy, about fitness, about personal training, even about nutrition, if it's on a general scale, I am certainly happy to get you started by having a conversation. You can give me a call at 262-842-2220, or you can email me directly at Jeanette@DeWittPTWellness.com. Go ahead and check out our website, www.DeWittPTWellness.com as well. Thanks a lot, and I hope to chat soon. Take care.